I was actually up to date on my annual mammograms, and it was normal. So in September 2024, I started to get right breast pain, and I ignored it for a little while. I chalked it up to we have a rambunctious puppy that I thought maybe, bruised me. So I kind of ignored it for a while, thinking it would go away, and it didn't. So that's what prompted me to get a diagnostic mammogram. It wasn't time for my screening yet, and that's when it showed 2 lumps. I was diagnosed with the triple negative breast cancer. I saw Jessica McBee for the genetics testing, and that's how we come up with the triple negative breast cancer diagnosis. I don't want to be just a number, and I knew at Mon Health I wasn't going to be just a number. I was going to be Heather, not a number. I worked here for 11 years. It was a no-brainer. I knew I would get the best care because I gave the best care. I know the compassion and the care that's here. I was diagnosed on January 29th. I had my port placed on February 18th, and I was getting my first chemo treatment on February 20th. That's a pretty quick turnaround. I love Dr. Craig. I got to know him, and I just love him. I would recommend him to anybody going through cancer treatments. Dr. Statler, she's awesome too. Like, I owe my life to both of them. Dr. Statler called me at home that Friday after my surgery, and she called me from her home because I could hear her children in the background. She just said, "Hi Heather, this is Kristen." She said, "And I just want you to know I got your pathology back and you are cancer-free." So that was just the words I've been waiting to hear since January 29th. I've had so much support. They're an extended family. Regardless of whether I used to work here 11 years or not, when patients walk through that door, they become family. There are no words. There aren't enough words. There's not enough thank yous in the world, but that's all I can say is thank you. So if I could give any advice to any woman, do your screening mammograms, but also listen to your body. If something's wrong, get it checked out, regardless of whether your screening mammogram was normal 9 months prior, 10 months prior, whatever it was. It's important. It's very important. And it all worked out because I'm sitting here cancer-free.